in series that have been started last week. You are very much familiar with the global trends as far as COVID-19 is concerned. You are, or you were at the epicenter. It broke out in China last year in December.
Yeah.
We became aware of it as a global citizen around January, February, and the world went into a lockdown in March. You guys were at the center of it. Um, you came through it. I don't know how you survived it because lockdown everywhere is uncomfortable, especially if you are a foreign citizen in a foreign
Yeah.
country dealing with a situation like that. We spoke to some of your colleagues sometime in April, I guess, on our brunch show, and they narrated their appeals to us and how they lacked support from the Gambia government and all of that, and how that impacted on their lives. I don't know if your experience was different or if it was similar, but before we get into that, I just wanted to know what is the situation right now in China?
Thank you very much, Nima. Thank you for having me. And first of all, before going to the program, I'll have to compliment your Kerr Fatou. I mean, you people are doing great, especially in this troubling time. Great. Coming back to your question, right now the situation in China is under control. One can say, as per pandemic, it is under control. Although we are registering some new cases, but we identify those cases as imported cases. And they are putting in all regulations into the people coming in through the airports. And there is a quick rapid test at the airports whenever you come in. Therefore, you must be tested, and if needs arise, you will be quarantined before they get you mainland China. So for now, people are moving in and out. Although social gatherings are still restricted, people are not able to come together to do as life was before. And when getting into public transports and very confinement areas, wearing of masks is highly encouraged. Actually, that is the situation we are in right now in China. Yeah.
Yeah, it's very interesting that you said what you guys now have are imported cases. Anyone would assume that because it started in China, cases have to be local, but that's not the case. But before we get into the program proper, I just wanted to remind our audience who Ousman Bajinka is. Ousman Bajinka is currently a PhD student in medical microbiology at the Central South University in China. You've been there for how long now?
Exactly a year now.
Exactly a year. And prior to that, you studied in Turkey. You did your master's also in microbiology. Am I right?
Yeah, exactly. Microbiology.
And you worked briefly at the MRC and also at the University of the Gambia Medical School.
Very right.
It's safe to say you have a whole lot of experience with infectious disease.
Yeah, that is our cohort. That's our domain.
Yeah, it's also safe to say you're an expert on how to contain infectious diseases, especially viruses like COVID-19.
Yeah, not to say as per expert, but with the little experience in biotics management, with the course I did with the University of Edinburgh, and also my brief moment as a biosafety advisor with MRC in Gambia. Yeah, I think, I will be able to dwell in as far as we can.
Exactly. And I think that's the reason why I am particularly very excited to have you on this program. The reason being there is so much talk going on because people are really concerned with what is happening in the Gambia right now. The discussions have been ongoing for as long as since March, when the lockdowns began. People have been suggesting to the government what they need to do to contain the virus. Before, our initiatives or our discussions were around how do we prevent an outbreak, because we know how weak our health system is, and prevention was our ultimate. I mean, that was the thing we could do to ensure that people are safe from the virus. But now that we're beyond prevention, it seems like an outbreak is happening right now. And the government doesn't necessarily seem to have a strategy in place that people could be confident in. We're going to get into all of those things, but I just wanted to gauge your experience with the whole coronavirus outbreak when it happened in China. How was that like for you guys?
Well, Nima, so to say, it wasn't an easy thing when the outbreak begins. It's like early December, you know, sometime when colleagues of mine from Wuhan, from the first epicenter, two of them visited my house, that is in Changsha. By the way, I am 3 hours away from Wuhan.
Okay.
And yes, this was the beginning of the outbreak. We have only few cases and cluster of cases. Upon their return, the Gambian Student Association in China, we were going to arrange our semester or yearly meeting in Wuhan. The preparations were already on high gear going to Wuhan. We fixed all the schedules we are on. But then again, this coincided with the time when cases were informed by the doctor. You might have, they call it the whistleblower. The West might call it that name. Perhaps it's a name given to him. In the medical fraternity and the hospital, I think confidentiality is very important.
True.
Yeah, when the cases arise, when few cases were arising, the authority and the medical experts in Wuhan, they thought they were able to control the cases before it goes out. And this is why the world was not informed. It was they tried their best, but they could not. Coming down to our levels, at students' level, yes, for some, this is their first experience when it comes to disease outbreak or an experience. But for me, it is not, because back in 2014, certainly when we arrived in Turkey, this coincided with Ebola case, if you can remember. Yeah. Yes, and
but you were away from the outbreak then.
I was away from the outbreak, but this was the time when people come from Africa, especially West Africa, and they are monitored very well. And it was a particular time when a Somalian friend of ours got malaria or something like a fever, and the media portrayed it as symptoms of Ebola. So that was my first moment of getting panic back in 2014. So coming to this year, it has never been, it was never a difficult task for me, actually. The only worrisome part was the differences between Ebola and COVID-19. Ebola was...
What are the difference? How are they different, Ebola and COVID?
Yeah, when it comes to mode of transmission, Ebola, it has to be body contact. It has to be bodily fluid contact. You will have to get closer to the person before the person transmits you. Yeah, but for COVID-19, as you know, it transfers through droplets. You don't necessarily have to be there. In a confined environment, if the person is infected, the chances of you getting infected is very high. So Ebola is easily controlled.
I just want to come in there, Ousman. I think we need to take these things case by case. In other words, just to break it down for the people out there, because at the end of the day, we are trying to reach an audience. People do not understand the severity of coronavirus and how different it is from the previous outbreaks that we might have experienced. So I'm going to take you through this the mode of transmission of coronavirus in Mandinka, if you're okay with that. I know it's very difficult for people to express themselves in their own local languages, especially if you're in an academic situation like this. But let's just try that. Coronavirus ka ala samunya sonayata nyameng. Wala yatina anin sasa kotongol fatata. Because atala samu mo mi virus odo wasi tara no dulato le ay boje ite yana atare mo mari tara jifang. Corona e samuila.
Okay, mbofono la manika konto nyaming walon transmission wadi ak sawun mola nyaming coronavirus musasa altimi alon ko jankoro nying akatara ni bafla droplets to account ade kenola fonyo tide bare nabe minna drone no to mbati sota ata jamfanola la fonyola betara la fonyo kono it nito sudiyari ngaldo ite fana sa niji no la yata coronavirus ka sawungo la nyama sawungo sone yata back affaire back okay ni situational jibe molka social life molka tara nyokan wati ma do kudla lon karamundro dawda fu mole tara nyokan dro so wala na coronavirus la sawungo abe wajabino la because molka tara nyokan especially in tola Gambia mi alon ko dulal kat deterin han moto fon kono kata deterin so ninkili yaso tumando waro na blata tabbo ko to kata Westfield jana be jila milbe biye be sa inhale nole be sa niji nole e virus o nyinta so coronavirus kata fonyo le kono so niya inhale adunta ni ngola kanana ibala jato le kono sai but aka bala jato fana la sufol follow min follow attack wala lungs ninku man ninkol ka fa kuf ka fa butu nafra kuf ka fa do yalon virus wala mechanism o katra oning bacterial ni fungal mechanism mankilia virus wala mechanism ay two faces le soro so naten futata aka min follow try drong ata akela cell sol ila body cell sol ninku epithelial cell sol mili alon ko wolle be kuf ka fa bala aka wolle follow ngaba butu nafta wala drong ay napu aba receptor le follow try na napu to wala deni bajala atela jorangol ninku ma atela DNA atela nucleic acid ala bari yalo coronavirus RNA le soto so ala RNA material o abole dundila etela cell sol kono bajala I will hijack ninku I will hijack ibaja na I will hijack so ila body cell sol ta realize no la ko if or immunio cell sol le bi tol ba mi ko immunio cell sol wato virus wala mechanism wala bo cell sol kono damani o cell sol le mi da wolle mutala do ya multiply fo ila kufka fa ma fon cell sol mi fo ya virus sol ya beta ninku mu ye coup d'attaque dem butungo ni coup d'attaque o be kan time mi no katra fana ila jibe destroy ka wala na ning covid-19 ya mimuta ni coronavirus ya mimuta na serious ta ibajale yakaje molka ka sula ni jiola because ila kufka fa duma aviola site wala fulo katinya so ibajale ko butungo fo tay oxygen so ibajale ko fo ite support soto drum mi alon ko mechanical support like afa ventilator pour ye pomper oxygen wala but butung virus o ye virus o soto moto kono lamban dawda long ate dunte balo kono amamira ko virus o naye soro do be falale okuma ya da bake pour moy je son yani senior molie mo kada mo discriminate akana stigmatization oti because ni mobe sa soro nole sometimes maybe dol ka sotole fon fay kendia imalon ko ya sotole adepende to immunity la ani be banko minga wala test capacity testing capacity because ning whole screening manke italon no milli positive sura milli negative sura so virus o nyufana na dundela fo janding abe symptomol kela e ko wol for incubation period aka wato tale to mando wato depende tala bala sojaro la to wawol ka fu ila body immunity nitala immunity is strong ibajala ko na duntela it will take time jani symptoms will be na dol bi jewol buka symptom fon soto symptoms so wolong mutu manni ko mbo fala nyami sainol komin toto bala kanno aning dol sain komin kundimol nin kudo sain ni kutamal min finde wala nyindi ko ibuka domoro serota ni domoro ke fana ibuka la testano wol fana bi jemi an ko kutola wol fana be at kanje wolo symptom wol mi yalan ko jandi be sola aka time o tale so but study fana mil findita because three cases le biye asymptomatic pre-symptomatic ani symptomatic exposure because pre-symptomatic itaka janning symptom wol binala isa mo sawni nole okay asymptomatic dol biye wol itamanta symptom of sotla but ika mo sawni nole so the severe time
virus o si parela bari ate sasandila ate landila
ate landila inaita so wala tina pro moy fix maxo dung akumara je bak butun dol ba fula fix maxo abuka virus o prevent niya dung odatina no la metra am imasato bari imankilia fix max be tankani no ku jamal fix max the technical the principle behind it nite ya soto ibaya ni toto abe danete dama hana be fintila ala fintota wajabino okay min miya dung nite toto na ya soto nite ya mi ya do nite toto dana ka futala ata penetrate no that womu one side womu transmissional side like but again halon ko dolbi je ka toto ibulo wala o ye surface muta ye surface muta tuwa scientists ka fu mi formite mobile on lomba fen lon bunda lomba mi alon ko do toto tabala because new virus on you can stay no for 8 hours more than 8 hours a dependala ni still ning kopalo ka traje for 2 hours barak fonyo kono in a close confinement a katrano no for 8 hours so na be te bulo bala to mando waro ni fix max o be wala hakilo be ni la fakere nya ma den ila mind balo no ko fix max le be wala ba je bulo be ha e ba jale ba limit no la another one mi alon ko kabriya fix max composer in Gambia I really appreciate it. And if you look at the scientific point of view, near GB, yeah, not sociobiology, because it got fixed is inconvenient. Kodi, mojama appreciate because it's inconvenient. So now collapsible pour kadung, obe makoiro kela pour la movement or limit. So ni mo la movement or limiter, obe makoiro kela pour nyimbe janjana nyame ofana limit.
Yeah, because ngaje ko virus o bukatama mo le kasamba.
Molle kasama, very well.
Yes,
Very well.
only more manta virus of an antifindila.
Yes, very well.
Okay. Yeah, so lafta ka gele emphasize virus o nyin kasa nyameng. Kon Ousman ya fo nyameng wolom virus o nyin kasa da ji fengol lel bala. Da ji fengol long nungi fengol long bang. Ni toto tata ni mo ni sutiate la sa no mare la. Wala si kono hani yin tableau min taba use kan si toto no tableau kan ne ay jolonje doyena ay bulo la kan ay ma bulo la te anyada ma anyala ma wala dale ma wala nungolom bang ay sangu because ya focus virus on fana ka sangu no dalong nungo ani nya akadunni wallal so mola ala severity wala ka jawya mola nyame would depend tay mari la bala kono sojarol lal ni la bala kono sojarol bambanta ni la kelo e kelo no bake isi virus o nyin keleno fo ate tinyar bake no le balobal wala antina mo jama kaso de ka kende ya abuke fa but ni la bala kono sojarol man bambang virus o nyin si wajabi no e balo kono le fay tinyar bake je fo asa ya sino dolma abowol kono molu mini yalon ko ke bayat because ni ke bayat sele sembodo yatal anu ni sembodo yatal la bala kono sojarol min si kelo ke no e balo kono fanan sembo si do yanu ani min yalon ko sasa ko ton bila mbe ko diabetes mbe ko hypertension and aussi ata Gambia bakele e kam min for high blood pressure ani cancer ani sasa ko ton jamala ni wol be jato ko no fanan kela bala ko no sojaro la ka aka ma fawo do yandi bakela ka sembo do yandi satina tarani jato ko no asi sembo so do meje
comorbidities wala comorbidities wo kuma ya bak pour mo jesen yani because Gambia tolla banko kan tumando waro ni sasa ma millani o bukata loptano do ka fan check okay ntol ni complication o katra sirine asthma long high blood pressure diabetes type 1 type 2 obesiar in Gambia warning different respiratory distress will be carrying for mol malo okay mil fana ka sabaro okay wol fana la kufka fa ninkum abe lanjurlen so akumaya bag sabaral akumaya bag pour moye fon tanka nyina dron okay yeah one point for yemi alon ka akumaya bag pour we put across for ninkel sa fo no ko ndol my immunity is strong ndebe ken diare ne mudinni ngolari hansai because of that it a worry la back to transmit pour ya soto but then nite ya soto ebe min transfer la OGB follow ebe min sawni no la OGB follow another aspect is recently this was 3 days ago recently there is a new study that they detect 90% of all the COVID-19 positive patients admitted in Wuhan hospital. Wuhan is a big city of 11 million people, right? It's a city of 11 million people. In Dollar Gambia, we are counting 2 million. So if Wuhan is having 11 million people and then they admitted thousands of cases because it was the first epicenter. 90% of all those who were positive and now they are negative, they were released back home. They realize that they are sustaining lung injuries. Yeah.
So akamunda ko hane akara virus o nyin jarate balo kono asi tiñaro ke no ibalo kono le miyalo ko asi meno kaka tiñaro ke ba.
Yeah. Because yalong COVID-19 mang exhaust the knowledge, there is a knowledge gap among bang hand science and this all we are working on it. But complication of miyalong ko after March keta e be mil sute kan wol kono eko infertility ka soto nole sako especially kale. Okay, when you could about those are the scarce among trend based on the evidence-based medicine. But new study, all you go, they are sustaining. And then what happened again? 5% of those 90% who were infected and recovered and are sustaining lung injuries, 5% of those are repositive. Positive. So whatever caring China for new watching on this was 2-3 days ago.
Okay.
So that means coronavirus, the only way you can even maintain like yeah, that's the only way. And right now, in all technicality in Gambia, our ministry have tried.
Yeah.
Nka moljele watu ya katabakele. Nka moljele watu wati they are talking, of course. Yalong mosa doko kenyawonya for ya lafa busola.
Busola,
but they've tried. To be frank, I was not expecting we go this far. Right now, sign on to make cases or register. Bankudolia register Juna. Now try just na technical lapses or lapse in a technical approach the lapse the money. We are experiencing this surge. But still we have a hope.
So technical lapse mina wotole bayri esido ko kata nyawanya landing alabandula la kumayat. Ni anata far labandula to tinyaro kera doron sembo kana wara bakele. But jani ngana woto komi min to nyalom Gambia bulata bankol ko no mini alon ko mole jiko soto num bakele ko asike coronavirus sembota wara Gambia kan niya jube kabiri March fombulata time jumala starta late July coming outbreak start out of control ufanan kono fanuta bakele time o mi alon ko na neighbor Senegal la cases will be rise kan other countries in Bejandam and Science and the US cases will be rise kan every day, but Gambia was able to contain dolba for la fo Tesla mantara ke kambang wala asabu bang dolba for la fo a strategy mean put in place for level work kambang but somehow kula yatina nung adama wajabinu. But in the midst of all of that, you more sort of mini alon, God for a lack of virus on sort of
very well.
At the initial stage, civil society organizations, civil society members also to me along they go out to sensitize people. Ye panel landile detergent sol kije mol ke bulo ko tata ko ko sifa tarajele ni dunta isi bulo ku ni ka finti si bulo ku mo jama ya foko way impact so no bakele because virus soka tara soves la bala na be bulo wala ni ke bulo hani nyaada ma the risk ni te wara la bake but not haje aussi fal mo me be talata mo la marse to tabalial nunto bari kabiri ko state of emergency kada at the initial stage mo jama bakata no marse mo jama katale ye fenjama san ya landi pour kata mo tala mo le la dinu muta sol kono bari 1 month 2 months mo le aje ko cases sol mantara sala kambake e ko corona mantara Gambia sai hani min yalon ko sonta ko corona soto do do falinde ko corona man soto so mobe murunta back to their normal lives ngaje ko mansa kunna fanan ka for state of emergency rek bari buka follow up ima do ko manke bake pour ka ensure ko hadama molio song ko virus on yin soto tale andu mansa kunda ba prevent kan ne wala yatina mantara ka wajabi bake but nim prevention o manke doron outbreaks e kenon and nata wala jaketa Saita la Geroto, Munayatina, we were able to contain from March to July, and science getting out of hand.
Well, you might call it we were able to contain. No, there was nothing like containment. There were no cases. There were a few scanty cases. There were no cases. Cases develop into clusters. Then you have community transmission. Me along call back here in Gambia side. Okay, among cases also the mil follow fenty ta all taral far band already. There was nothing like any case. So walatina case bang arise, there man spread, more man numbers all general. Okay. Me have no numbers all for now sojta. Reasons will be me along ko saying maybe at a proper time for us to start a blame game. But abenyamin tonya.
For me personally, I don't like when people call it a blame game. If near more kere ye londi ko nyine mala do koti, nin do ko mantara kata nyama anu ntoli bela batala ba kono. Kwesi more so therefore jamman ka nyama de maybe nyanta ka ke nuntan maybe nyanta ka
nimbe mistake o jibela. Nimbe na mistake o jibela. Follow. People moving in and out of Senegal, you have to blame those people. Milka move in and out of Senegal, like a smuggle. Well, follow people blame because Gambia airport was running in state of emergency. Moment ranakano. So Senegal people were mulka border porous border nyika dunna ni wale ka finti. So nibe blame follow blame la. But again, the technical side me along state of emergency was put across was not based on any scientific expertise. Malaya advice to the National Assembly forced 45 days. You remember it was 90 days they had to argue and bring it down to 45.
Yeah.
That was too much. That 45 days
wasn't even necessary at the time. Yeah.
It was way too much. It might be necessary for us to go on the incubation period. This is 14 days. Yeah. If they can extend it, make it 21 days, perhaps the public, okay, it can mean for a state of emergency, they are working according to the guidelines of WHO. Incubation period or GBA so that we see that is the window period. In case man arise, then life can move on. We can say there is no coronavirus in Gambia. But then it only have Somalia extent of 45 days. But in Gambia, if you are employing lockdowns, me along can state of emergency mankilia. But then New Bay, even those two, both lockdown and state of emergency, near GBA is one way or the other affecting the lives of people. Conflict of interest like arise. We are not well off to be at home and feed our family. This is the truth. Coronavirus is scary. This is very true. And then it halts the economy globally. But again, Malta sino la so kono fana konko ye muta, konko la jawi ara coronavirus if we are to stay. Because right now we are having 1.7% fatality. Nin keme keme ya so mo killing aninto wale be faka. So nin family we siring man domoro okay, the consequences will be high. So that 45 days was too much. Wala yatina molman state of emergency ma hono kotanke. Wala yatina molma bunya molman jiki kotanke. So then kabin molman jiki fana jiklate onara. But Gambia fana mim fana mo problem wati. Well, we have to say dolbe mu Gambian old. We have experts and intellects in their various area. But nimu teachati ka history teach. I think it's better you talk to people with history. Nitemu history teacher
on everything.
Very well. Nitemu history teacher ibe community kono people saw you as a role model. Yenyi ninga iko Mr. iko coronavirus of yeko ali alkane damo coronavirus ota Gambia ibe kodi nyinol. So nyinen tolla awareness on yimbe manendi. With all the
campaign. Mune muitala daliloti kafuko corona mansoto Gambia mune la daliloti.
Yeah, okay. Ite be nyinin kala mine la daliloti.
Yeah.
Ite be nyinin kala mine la daliloti. Maybe they will respond to you, but don't be ye jibela as a role model. Wolte nyinin kala. It takes time before I could convince my mom that coronavirus is real. Despite I'm in China, I'm stranded in the house.
You're not alone.
It took me time to convince her that coronavirus is real.
Yeah, but lafta kana jeli kuma maja kuma na bakele sai mul bo fana discuss kan bake kom tonya ntol especially ntol mi alon ko be media mo jamalan kabiri ko corona findaran kija faro ya na mo be rosta ko mansakunda you have to put measures in place. Anun fo sike wate because ningin si fal keta ntol fana na jiko ka ke toilet pari toilet ben tol nyaato do ko wala bari ngamin koros wolong mansakunda fana ke la moy kumo belala pate ko teng nyimma ko teng Ousman ko teng they take it on face value. They rush to respond reactively to what people are saying without doing a proper assessment, because at the end of the day more baby opinion sotolale bari mansakunda decision should be based on expert opinion. assessment, scientific assessment. What I from the onset, ntela argument keta minti wolom, WHO guidelines landile miniango is global. But global realities are not the same as local realities. Niko Gambia social distancing. More Kamela from social distancing, they don't know what it means. Can social distancing have an effect in the Gambia when you have 12 people living in the same household? Mini alonko itol be tadulal ka fatale. Do bita supermarket, do bita la do kudulado, do bita loptano, wol be muruna na be mina sila bunkili ngala kono. Ya social distancing te work la no. Wala ntala fenkum keta minti wolom. Gambia really needs to strategize from within, based on our local realities. Ngam found some guidelines so landi, mini alonko be global guidelines le complement la. From the beginning, that was missing. Nim 45 days me ya for mojama ya for fananko. What time it was too early to declare a 45-day state of emergency because cases all mansiano. Moli and me recommend Wolam close the borders, all the border entries, close them, and allow life to go on as it was internally. That is the cases are surging now. If you place those requirements, those regulations, people will respect them. But because we had an experience with 45 days, then 7 days, 7 days, 7 days, and people got tired of it. We got fed up with it. Now, Niko regulation on Murunlanang. Do you think it's going to work? Do you think people are going to respect it now?
No, you are making a great point. Now that it has already surged, our sole responsibility for now is to limit the spread and contain it as much as possible, and hope that this is our peak we are seeing. Okay, with regards to the ministry's approach or the health ministry's approach, that requires a holistic analysis as per Gambia. We are not well off, you know that, right? In every sector, we are not an expert, but every sector we have loopholes. In the health sector, yes, you might agree with me, but we are not well equipped when it comes to disease prevention and interventions. We are not there yet. We are struggling. Our system is fragile. This was what many people will be talking of since at the beginning. Our system is fragile. Our technicalities are not to expectation. This is the reality. They are struggling. Okay. You are right. You are right. Very well right that there are policies that they put across. But then if you look at science and policy, the policy makers were the one that makes things difficult. If policy makers were consulting experts, when this was happening, what were they doing to study how China contain, how Singapore contain, how Taiwan contain? Even the Western world, they were looking at the model used by these particular countries, and they try to see how best it fits in their system. WHO, they've already formulated guidelines, but they made it clearly these guidelines might be worked in consultation with the national or local guidelines, you might say. So Gambia, I see no reason why they were not consulted. Perhaps they have someone somewhere, expert, advising them, but the technicalities at the ministry level, the technicalities there were very low. And people like me, if you will ask, I will tell you that they were more concerned of the COVID fund than the preventive intervention. The money.
Do you think what is currently happening now is enough? Do you think they are doing enough, even as we're speaking?
That's the best bet we have. The best bet we have is to introduce this curfew, yes, and limit the movement of the people, make face masks compulsory. When face masks are compulsory, people will feel it inconvenient to go with it everywhere. Then people's limitation, people's movements will be limited. And once they are limited, the spread might go in a slow pace. This is our best bet right now.
And those things are in place. As far as I know, curfew start at 10 p.m. to 5 p.m. 5 a.m. in the morning. And places of worship are not entirely closed. We're told that it is only open for call to prayers. In other words, people should go there, call to prayers, and then go back. Nobody should congregate. right?
Yeah.
Those things are in place. Face masks, compulsory face masks are in place, but our problem has always been with enforcement. What is your impression about it right now?
I was told it's a joint force. Someone has told me that it's a joint force. Most likely, if there's a joint force operating, the petty corruption that we normally experience might not be something availed. But for me, a technical point of view, I think until now, Gambians are not very much aware of COVID-19 in the sense that they are not aware of the technicalities there. I mean, how to prevent, everyone will tell you we need to wash our hands, okay, we need to wear masks, we need to, cough on our elbow and stuff. Okay, these are very normal. These are the common things that you hear from everyone. But deep inside, what biological and risk assessment has been done? The face masks we are using in Gambia, what standardization has been done? Gambia Standard Bureau.
Thank you.
What standardization has they started on the fantingo, the wax, the local clothing that people are using? Has it gone under quality control? Yeah, has those things gone under the quality control? If people use masks, where are they throwing these masks? These masks themselves are biological hazards. Some people in Badibu might say, well, nobody should share masks in Gambia.
Yeah.
So these are the things that we are lacking in technicality. And if we are not careful, you see, cases are arising among the healthcare givers. So one should ask, if cases are arising among the healthcare givers, that's a good news for Gambia. That means the cases, clusters of cases are within one perimeter environment. So that means it's not as spread as community as far we might think, because the policy, the strategy that Chinese use in Wuhan at the peak of the outbreak, then it was not even a pandemic. Healthcare givers, doctors, nurses, ambulance drivers, they will never go back to their family. They were allocated a hotel.
Yeah.
From their service to the patient care and management, they are going back to the hotel. That's where they spend the night, and they will go back on their service duty until they were released for 2 days or 3 days off.
Okay.
So people don't. So
in other words, contact between healthcare givers and their families were limited.
Yes, very limited.
They were being isolated away from their families. That makes sense.
Exactly. This is the reason why the ministries and all those are infected, because they were not seeing it that way. Yeah. That health personnel who was in contact with the patients in the quarantine is a biological risk. He himself is a super spreader.
Yeah.
So we have super spreaders operating in Gambia now. Unless we understand the biological risk measure, we will be there experiencing cases. I am not expecting cases coming from community, like we say Bakau has a lot of cases. No. I am looking forward to see this pass of cases occurring at the quarantine centers, way to the hospital. Okay. This is prior to the confirmation that you are positive for COVID-19. You might be going to various clinics and the hospital. So during this process, if they will do an epidemiological studies and project, they will realize that these were the ways in which cases in Gambia were surging.
Yeah. So you are saying that places that are mostly at risk are the clinics, the hotels, the quarantine centers where people are being quarantined, right? Exactly. And among healthcare givers generally.
Yeah.
So what is your recommendation? What can we do to address that?
Yeah, that's the preventive measures WHO put in place. And we have to bring it down to see what best suits us. The standard recommendation to prevent the COVID-19, it includes frequent cleaning of household or alcohol-based hand rub. Use your hands using soap and water, covering the nose and the mouth with flex elbow if you are coughing, for example. If you use tissue or masks or use masks, they have to be put in a biological hazard waste as a biological waste hazard. So the ministry should provide that one at strategy locations for people to put in their biological waste. Yeah, this coronavirus.
I just wanted to emphasize one technical point that you mentioned, which was a best practice in China, isolating health workers away from their families, at least temporarily, as a means to prevent a widespread of the virus. The money is there, or the money was there. We don't know what happened to it now, but there were a lot of expectations as to what could be done with that money. Currently, what we are seeing is people coming into the country and being quarantined at isolated locations at the expense of taxpayers, right? What people are recommending is, if you want to travel, because people naturally has to be mobile, you cannot lock people down for an extended period of time. People need to move. We need to move around. But if movement is going to happen, it has to be at your expense. Say, for example, you want to travel, like I did, to the United States. You know you're going to be quarantined for 14 days. You have to be prepared for that. And if there is a cost attached to it, you know that you should pay for the cost because it's your choice to move, right? It was a choice to move. I think it should be mandatory. I just want to finish up with this. I think it should be mandatory in the Gambia that Gambians who are coming back into the country should know that they are going to be quarantined for 14 days and they're going to be responsible for the cost of the quarantine, so that becomes a policy and that is known to everyone that if you make a choice to go to the Gambia, you're going to be isolated for a certain period of time in order to safeguard the lives of other Gambians that are on the ground, so that money that is now being spent can be used to find an isolated center for the healthcare workers to be temporarily isolated away from their families. Does that make sense?
That's a brilliant economic policy. And also it's a way of discipline. Perhaps if you tell someone that all the expenditure will be at your own cost, probably they might also think twice before landing themselves back in Gambia and putting our country at risk. That is very true. But when there is something that is also lacking in Gambia, Nyima, the Chinese, the head of the Chinese authority in this pandemic said there is something that is missing. Once it is there, it's going to be very easy for you to overcome whatever you are doing. And this is the speed. This is speed. Yeah, speed. The faster you get into any interventions, the quicker you can contain. We are talking about a virus in the air. We are talking about, I am talking to you, you will get infected. You talk to somebody, you infect someone. So the quicker we put in our interventions, the quicker we put in our public health approaches, the better for us to do. But in Gambia, we are slow naturally. You know, you and I, we know. But
and we like to work behind the scenes as well. We don't like to be visible with our approaches, with our strategies. It's easy for the ministry to say this and this and this is what is happening, but nobody is seeing it. It's not present. And if that is, people always say seeing is believing, right? You need to be present with these approaches and your strategy so that it becomes clear, so that it's not just your effort. Everybody has something to do to contribute.
So this has to do with us in China, not per se the entire China. The Gambian students population is large enough, but in Wuhan and Changsha, this is like two provinces close, south and the central China. This is Hubei and Hunan provinces. We form Gambian scientists in China. There's a group we form. February 10th, when coronavirus was not in Gambia, we designed a survey for us to assess the personnel, the capacity, the skills, whatever is needed in Gambia for us to make a survey. And this survey was going to be counted by health personnel, the nurses, the doctors, the lab scientists, even the pharmacy, ambulance drivers. We designed this survey and we sent it. I personally am the one leading it. We sent the email to my provost for ethical approval, and Vice Chancellor himself was copied in the email. For some reason,
Vice Chancellor of the University of the Gambia or your university?
I represent the University of the Gambia in this case, because the study was going to be conducted in Gambia, Okay. University of the Gambia should help us for ethical approval so that we can go on with it. But again, it's just an observational or cohort study. It does not require any human sample or anything. So once we realize that there will be a delay, perhaps they have a lot of things in their table, they could not come on time. So we move ahead to talk to people. But what we did, we have a senior nurse in the group and a public health officer who is now in Gambia. And we send the links to their various colleagues, nurses, public health officers, even my own students. But out of all the numbers we are counting, the nurses, the doctors, the public officers in Gambia, only 8 responders we received for the survey. This survey was going to access, this survey was going to assess where our loopholes are, because we foresee that this will come to Gambia. Gambia is very prone, we foresee it, and we decided to do that. But then the response was just 8 respondents, which is very small. It cannot represent our sample. We could not move. The reason why I'm emphasizing this is we are slow with our dealings. We are slow in our dealings, and we don't actually know what is even existing in our environment. The only way we can do is research. We propose this survey. It will take them less than 5 minutes on their mobile phones to respond to our questionnaire, and then we have a data that can be analyzed, and then we send it for the information for the country. We could not. This happens. Recently, I'm trying to talk. I'm trying to link Dr. Bite. Yeah, I'm trying to link Dr. Bite. Perhaps, when the cases were in Sojin, I was trying to look if there are possibilities for them to air me back to Gambia. Why will I be in China when our people are facing expertise? They could not. Perhaps if I will be there, I can use my skills at the biorisk assessment and try to see how best we can do. But then one thing or the other, because there are no flights flying from China to Gambia as of now, and because also he has a lot of things to do, it's taking time for him to reply. But then there are a lot of Gambians that could even be reached to, as we are speaking. That can be back in the country.
Providing data, that's going to be used. This is something I have always said. Why are we working blindly, or we are working with somebody else's data or somebody else's provision that is being generated based on their context? Because context always matters. Research-based approaches always work better than just doing things based on perception. Right? Yeah. Because that's what helps you scientifically to know how to approach, what to do, and what variables are in place to ensure that your measures work.
Yeah, the proof of the pudding is in the eating. We have a lot of Gambians abroad. These are experts abroad, and I am sure they will be most willingly to go and render their support if those are open for them. So
your call now is, just to clear this, your call is for the Gambian authorities to reach out to Gambian scientists abroad.
The Gambian authority to open their doors.
To open their doors.
For Gambian scientists to send in their interests. And we see how best any of us can be fitted. We go and cope our problem.
Very well. I'm sure that message is clear. So I just want to move this along a bit quicker since we've been up for a while now. What is the way forward for the Gambia? Just from a technical point of view, what should happen now, moving forward, to ensure that this is not turned into a calamity?
Well, right now, our best bet is what we are doing. I'm very much impressed with the last-minute intervention the government or the ministry are doing. The curfew, the obligatory wearing of face masks. On top of that, or in addition to that, we have to be very much reasonable. The virulence and the epidemiology of this virus is crucial. Even to the virologists and the epidemiologists, it's not exhausted. The knowledge gap is still there. It's not, we don't know much, we don't know everything about COVID-19.
In other words, we should research as much as possible.
Very well. Research as more as possible. because it is not exhausted, and we should be open enough to how will I call it? We should be open enough to embrace whatever information experts put forward. There were a lot of audios that I came by on WhatsApps. People in the diaspora will make audio, sending it to their colleagues, their families, that there are vaccines coming in Gambia, spreading fear, anxiety among the population. These are things that I think the government should at least try to, if it happens in Gambia, to find ways. In China, nobody is smart to do that. If you spread false information, you are likely to be censored.
Yeah.
Those false informations were our problem. That is why we could not believe at the first place. And that is why our preventive measures were reluctant, because if you don't, you don't believe in what you don't see sometimes. Seeing is believing. Until people are dying now, this is the time Gambians knew. So for us, our best bet is to go on with that. The global citizen, which include Gambia, must be reminded that in as much as we suffered loss, pain, or unending anxieties, there is one thing fundamental that we must always remember. This is an outbreak of disease. Just like flood, storms, or volcanoes, or earthquake, they are also natural disasters. In essence, there should be no stigmatization or discrimination. People should be okay being positive. People should not see themselves being marginalized when they are positive. They should come and clean at the right time for any intervention. Both the medical institutions, that's our ministry, and the government should be honest. They should be transparent. If they don't know, let them hire experts. Other African countries are hiring Cubans. If we cannot do that with our COVID fund, open your doors to the government expert that can come in. We should be honest and transparent. We can win this war. It's like there's hope. Our cases are on one cluster. That's what I'm saying. The cluster is coming from the health sector. They're all coming from the health sector. So if we do our proper biorisk assessment, we'll be able to cope it. WHO is also continuing. The 2020, they continue to advise daily importance of solidarity when it comes to fighting a common enemy. So people have to come together to work. The political decision, the political interest has to be put aside. We work together. We fight the common enemy. Then we can go for our political heat.
Yeah.
If there are people undermining the intervention of the ministry for the sake of the politics, well, perhaps they might not live to see the change that might be effected.
Yeah, but again, I just wanted to come in there because you touch on something that is very fundamental, and I have been thinking about that myself, and I hear people say it a lot, that this should be a concerted effort. It should not just be a government war. It must include everyone, including political parties, civil society organizations, community leaders, and so on and so forth. But the leadership should come from the government, especially from the presidency. Somebody should be there to show guidance, to inspire the public to rise up above this virus. But somebody should also be there to mobilize voices, to mobilize support from within all of these communities that I've mentioned, the political parties, the civil society organization, community leaders, to bring them on board, to formulate a strategy, a broader strategy that includes all of these actors. But so far that is lacking.
Yeah, everyone is affected. Everyone is affected, directly or indirectly. If one is not infected, the outbreak already halted global functions, and everyone should strive to ensure the bad memories are never repeated. The leadership has to come from the central government. This is very well. But then I will not wait and sit to inform my mother, my close family members about the risk, the dangers attached to COVID-19. I will not sit and wait for the president to do that. In sense, everyone has a role to play. If you are an expert in any way, at any point in time, regardless what party you are affiliated, you come forward. The government failed to put in their policy probably the policy is not enhanced by experts' decision. And expert decision, we cannot blame anyone. Like I tell you, Gambia don't have science. The only few scientists are MRC. This is why we are using MRC facility. The Gambia did not even have infectious disease or research center. Do you know that?
Yeah.
We are not able to produce scientists until unless you pass through MRC and you're able to know how it is. Gambia at Science, how many students are being enrolled to go to science, senior secondary school? How many of them will make it to the university? And how many of them will come back? We have to open up a lot of issues. We have to make a holistic approach. Our departmental area has to be open. Young Gambian scientists will have to be encouraged. This is COVID-19 pandemic we are talking about. Do you know that there are a lot of pandemics on the way? We are talking about the end of time. We are talking about the Third World War, not bomb or nuclear weapon. We are talking about bioterrorism fight. We are talking about fighting against common enemy. HIV and AIDS is still a pandemic. It's killing people. We have to get ready to combat a bigger war. And in that, central government will do it, but government comes and go. We need structures as state. That state comprises of people.
We must be strengthened.
We need citizens of sincerity. We need people, we need Gambian citizens of which are sincere, who will see the country first before anything. And we need to diversify. We need to go into the sciences.
Okay, so finally, I just want to talk about the COVID money. A lot has been said about it. We've heard about so many donations being made. It's in the billions of dollars. And we haven't seen in practical sense much of what has been done with that money. If you're going to make a recommendation, given the money is still there, hopefully it is still there. It doesn't seem likely that it is there. But the little of what remains, what do you think should be done with that money to ensure that we are fully prepared for a future pandemic or even dealing with the present one?
Well, as you might say, the money might not be there. That means fraction of the money is already been diverted to something else.
Yes, that's very likely.
I will never forgive anyone who embezzles or diverted the money stipulated for COVID fight under the second. I'm a citizen of Gambia, and I am young. I'm yet to see what is happening, and I'm devoting my life to Gambia. I am a lecturer at the State University, and I will go back. I'm even working on resuming my teaching duties while remotely.
Continuing your research,
if anything might go in way, I will never forgive on them. And anyway, since we have no proof to say that money has been diverted, but again,
there is ample proof though.
Well, that might go onto the legal sector, and then I will be very much grateful to see people being accounted for it. I'll be much grateful. But the little fraction that might be left, I and you might be seeing, if there is at all, we can expand our healthcare system, our hospitals. Yeah, we can expand our hospitals.
In what practical ways?
Equipment, facilities is built more. For example, we are not having place for quarantine.
Yeah,
we still don't have, and we don't know how much cases we are looking up to. We are still fighting. But again,
you mentioned the lack of an infectious disease center being at the lack of an infectious disease center, and the fact that we continue to rely on MRC. Those things are temporary. MRC's presence is temporary. I think moving forward, I would see Gambia taking this opportunity to build a facility much like the MRC, so that in their absence, we would have to be able to rely on ourselves.
I am not very good with money, but I am not foreseeing if that money is enough for them to build infectious disease research center. We are talking about a huge intervention.
It can be a good beginning, you don't think?
Yeah, it can be a good beginning, and then it can be stipulated in national budget for a long run, And then of course, look for other funds. There are funds available for such. Until unless we prioritize science, we know, I mean, young African science, they're growing up. We don't want to be relying on the West for the vaccine trial. We don't want to sleep and wait for them to develop vaccine. Imagine they were going to test vaccine on us. Two French, we are talking about it on the media. I mean, it's high time we start on our clinical trials as well in Africa. It's high time we intervene with our infectious disease. We realize the burden of Africa lies in the tropics. We are still fighting with tropical infection. So
I agree with you.
Gambia,
I mean, that's the saddest part of it. We are all waiting for the vaccine to come out, but we are not waiting for ourselves to do so. We're waiting for somebody else to develop it. And that is really, really sad.
I always ask myself, we have Madagascar herbs there. What is it waiting for? I mean, why not we try? We don't have a proper cure for COVID-19. Whatever you do, we cure symptoms. Whatever you do it to cure someone. I mean, I don't know why it is there. That one too is a concern.
Yeah.
The inferior complicity has to be limited. What comes from the West is better, and what produced locally is still locally. I mean, we have to.
Regardless, whatever is local or non-local, I think everything should be subjected to a scientific process. And scientific process is important in this case, and that is mostly what is lacking. Even in our own backyards, we might have herbs that could work, but it's not enough to just say this herb works because it's being produced locally. I think it's important also that we subject them to the scientific review to ensure that they are safe for human consumption and that they do not have drastic side effects.
Well, I think that is what they claim of being waiting, but then Madagascar has supplied this to many countries. Why not they link with those other countries if they don't have the quantitative analysis? Because they have to do the quantitative analysis to see it is fitted. But if they don't do that, why not they contact other countries who have been using it? It all has to boil down to making efforts to know what is going around the surrounding.
Okay. All right. So I just wanted to say thank you. Unless you have anything additional to say, do you?
Yeah. It's a collective responsibility for us to fight this virus in order to stop further spreading in Gambia. We can provide right information to the public. If we do not come together to fight, win the battle, we might not be lucky to see many epicenters emerging in Gambia. We might not be lucky to see. We might not be lucky to see cases developing into clusters in community. We might not be lucky. We are not looking forward to that, but our only best bet now is to join hands with the ministry, with the public health officers, help them across. And one advice I will always want to say, I will not be happy if I will not mention that. The frontliners, people working at the front line, they were working very hard, but mistakenly they could see money before their duty online. These are our staffs being paid monthly salary. The allowance is not a right, it was a privilege. Some reluctantly left their point line of duty, and probably it might resort to a search. The National Assembly members who voted against the state of emergency will have to rethink, and the community will have to be sensitized. Who are we to send to our National Assembly? Decision making is not for everyone. Sound-minded individuals are very important in there. We need to have an expert, medical expert in National Assembly. This might not be a medical doctor, but it has to be somebody who is more concerned with the environment and disease surveillance. And the government policy has to be respected, and they have to be stand firm in order to fight this. Right now, what we need is hardcore policy for us to cope the situation. That is our best bet. Yeah. I think that's the information.
A lot of things remain controversial, but we may not have time to go into all of those things, given that this is a tri-continental broadcast, you being in China. What time is it in China right now? I know it's very late for you. Is it 3 a.m.?
Yeah, it's 1 a.m., but then it's okay for me.
1 a.m. Yeah, so it's 1 a.m. in China and is almost 12 p.m. here in the U.S. I don't know. I think it's about 4 or 5
p.m. in Gambia.
5 p.m. in the Gambia. So I'm very happy to have you here to share your knowledge and your experience with us. Just to round up quickly, what we have discussed here, coronavirus is real. It's becoming very real for people who have been in denial for so long now, given that we have started to see people die, because previously when you tell people corona is here, they said, I haven't seen anyone who died. And my answer to that always has been, may you never see someone who died from corona, because that would be too close to you. And you don't want corona to be that very close to you. So we're beginning to know people, we're beginning to hear about people dying from corona. I hope that, and I pray that we take it seriously and we are able to prevent ourselves from contracting the virus. But the way to save yourself from the virus is to continue to wash your hands as much as possible with water and soap. To wear the face masks is very important. Even here, we know Trump land has always been in denial. For the majority of them, has always been in denial. But it's been enforced here for people to wear the face masks. I remember when we visited, when we go to the Eid prayer, people have been asked to pray very close to their cars as families. Families were separated, and everywhere, everybody wear the face masks. So if an advanced country like that, where people can rely on their facility, their medical facilities, the capacity here, and all of that, if they are able to take it seriously, we have no reason to deny that this virus exists and that we should be able to prevent ourselves. But also the government needs to be proactive. The government really, especially the authorities that are responsible for containing this virus, need to be proactive. They need to be present. They need to be visible, and they need to be willing to mobilize support, to mobilize voices from political parties, opposition political parties, from civil society organizations, from community leaders. I saw on Kerr yesterday where imams were on to sensitize their people. Those things are very crucial, because everybody has someone that they trust, that they want to listen to. You want to have the alcalos speaking to their villages. You want to have the imams talking to their congregations. You want to have the fathers or the pastors talking to their congregations. You want to have political party leaders talking to their supporters, civil society organizations talking to members of the society. And this way, we continue to sensitize one another, and we can complement government's effort in this way. But also, expert opinion is important. Data is important. Research is very much important, and there are clusters of Gambian scientists across the globe who will be willing, if not by being present physically, but they will be willing to offer support virtually in whatever way that they can. The government has to be open enough to know that they do not have the capacity, they do not have all the knowledge, and it's okay. It's okay to always seek support from outside, especially from among your own countrymen and women. So that's what I wanted to say. Thank you very much, Ousman, again, for being with us. I'll be here again on Wednesday with another lady who is doing very much well here with older women and their experience with COVID-19. Thank you.
It's my pleasure. Thank you for having me, Nima.
You're welcome.